The Chest Cancer Research and Treatment Center is a way of bringing people together in different disciplines of medicine. Particularly that means surgery, radiation oncology, medical oncology, as well as pulmonary medicine. And we feel that that is important because most patients with cancers of the chest do have multiple areas and multiple modalities of treatment that will be necessary in their care. And by determining that treatment strategy up front, we can get a better outcome with patients.
Patients who have lung cancer, many times it's not a disease that declares itself clinically until it progresses into the late stages. So lung cancer screening has become a new armamentarium for fighting and improving survival for patients who have lung cancer.
You know, most of the advances in the treatment of lung cancer have come through early detection and treatment of patients with early cancers. And we do have a program, and it is part of a national program and national recommendations to screen patients at high risk for lung cancer. And by high risk, I mean patients who have a smoking history that's extensive, patients who are older. We feel that it's important to screen those patients for cancer, and we have a program set up that allows a very small amount of radiation to be given to patients to obtain a CAT scan and see if there might be findings consistent with an early lung cancer.
Once we receive a referral, we start connecting with that patient by reaching out to them. We call them. We let them know what the next steps will be and getting them seen by one of our specialists. We ask questions and assess the patient to determine where they're at in their current treatment plan. We help facilitate their appointment and let them know next steps. We would provide them with information about our campus as well as directions, and also the resources that are available to them should they need those.
As part of a multidisciplinary approach, we have a multidisciplinary tumor board that meets every week, including pulmonologists who evaluate lung function. We also have pathologists who review the biopsies of patients to make sure we're making the right decisions based on the right elements of the tumor. In addition, we have a whole group of other people who can lay eyes on this particular case and give their perspectives and make sure we're not missing anything.
Surgery for early stage lung cancers, or perhaps radiation with particular modalities of localized radiation, and then chemotherapy and other innovative techniques including immunotherapy, clinical trials, etc. for late stage lung cancers is usually the norm.
We have at this institute a great deal of experience performing minimally invasive surgery. Every patient that we see we consider for minimally invasive surgery, and clearly patients have benefited from this. The recovery time for patients is much shorter, the pain after surgery is much less, the return to work for patients is faster, and it's something that clearly should be employed in every patient with lung cancer.
There have been significant advances in the lung cancer medical oncology field where new disease treatments have come up such that improvements in survivals are well known of. These do not just include chemotherapy but immunotherapy, and of course now targeted therapy for patients who have particular types of genetic changes in their tumor. And when you do have certain types of mutations or gene rearrangements, they may be amenable to very good therapies with basically pill-based approaches. And these are now very widely available across the country.
As a part of achieving the best possible outcomes and most advanced outcomes, we also have an area of treatment called interventional pulmonary that is able to perform procedures from the inside of the windpipe as opposed to biopsies or other type of procedures that might require incisions. So having that particular expertise as part of our team has definitely helped us do things in a less invasive manner, and we can definitely make patients feel better and breathe better.
Integrative medicine is by far and beyond an important approach for all patients with cancer, not just lung cancer. Patients with cancer have multiple needs. It could be pain-related issues or psychological comfort, as well as, of course, physical care.
By having multidisciplinary meetings, working together, we're able to establish the plan, make sure it's coordinated, make sure it's timed well, and this, no doubt, improves the outcome and the chance of curing that patient of cancer.